Thank you and welcome back. The committee's back from recess. I just want to touch up a couple of issues. Director Linda DeNorsi, so are you aware that you are the primary public health authority, and what does that mean to you, having been designated that?
Yes, I am aware I'm the public health authority, and what that means is I am responsible for the Department of Public Health and our response in regards to any emergencies. In this particular case, the virus, which is the COVID-19. And so my job is to ensure the safety of the community, and my job is to make certain that all the public are made aware of this outbreak and the pandemic, and that we are to do our job, which is to ensure that all aspects of our entire incident command system is in place, and from the department's perspective, to make certain that we have our investigation unit, our containment, our isolation, our whole system of staff that are able to do contact tracing, surveillance, and follow up, and to ensure that we also do what it takes to do tracing and contact follow-up, household follow-up, community follow-up of all known positive cases, and also to make certain that if there's any infection, the whole community gets very educated all the way about this whole pandemic. I also know that I have full authority when it comes to isolating and quarantine, to ensure that the quarantine aspect is there, because the incubation period of an infection occurs between 2 days to 14 days. And the purpose of the quarantine is just to ensure that there's no further spread of the disease, and that we're able to monitor travelers that come and that they don't introduce the virus into our community. And if they are exposed or they're known to have been in areas of hot spots, that we ensure that they are in an area where they can be monitored, so that if they become asymptomatic to become symptomatic, then we're able to provide them the care that they need and keep them separate from the community, so that they don't go out and contaminate other individuals in our community. And so that is my primary role, to ensure that there's delay in transmission, and if there is any cases out there, that we contain and delay further transmission to protect our entire island.
Thank you. And that act itself, it gives you authority to procure and nobody else.
That is correct, according to the chapter that authorizes that. However, my role in this case was really my procurement in the aspect of the department. I am a line agency of the Department of Public Health, which is a line agency of the government of Guam. So when I procure things, I have to do it through proper ways, and specifically all our requisitions become purchase orders. If I'm going to, in this particular case, what I have been involved with is with DLS, the Diagnostic Laboratory Services, we had a letter of agreement that was done, and then we further on had an MOU that was reviewed by both parties, the AG and also Diagnostic Labs legal counsel. And then we had a purchase order for those laboratory tests, so that we can increase the capacity for us to do testing, not only with our laboratory at Public Health, but also with the other laboratory. And then in line with that, my goal was to ensure that we had enough nurses throughout the community, because we were in charge of providing support to the airport, to the Port Authority. We also had support for all the isolation quarantine areas, and also the public health facilities, so that we can continue to monitor patients and to provide the services and continue to function the primary healthcare centers of Northern, Southern, and Central Public Health. And we also established a public health facility that is up at Barraga Heights for this particular disaster, so that we can provide services at all angles. And in line with this, knowing that nurses were really scarce in the whole community, and it's a great shortage everywhere, we were able to get the support from the other government of Guam agencies, such as the Guam Department of Education, where we also had their nurses, and we also were getting the support from Guam Community College. And again, we were able to work hand in hand to put them in different places, as I mentioned earlier, to provide that support. In line with that, we also had other sources, and in particular, my role was to ensure that the services that are rendered are adequate. So in the beginning, when we were going through this process, we had I had a MOA that was given to me by the Health Service of the Pacific, and in that case, that was I reviewed it, and I showed it to the governor, and I showed it to her because we really lacked a lot of nursing services. And so that MOA was actually signed by the governor on the 20th. And then when I looked at it, I signed it after she signed it on the 19th, excuse me, and I signed it on 20th. And then the other party, which was Health Service of the Pacific, was supposed to sign it, but they didn't when it was given to my office. So I called them and I asked them if they can sign it so that we can proceed to the next step. And so when I talked to Health Service of the Pacific's administrator, Lisa, she said that they're going to have their attorney review it first. So that's what happened. And then what happened was I never got a copy of it, until before April 24th. I get another MOA, and that MOA specifically has it, which was different from the one that I signed with the governor for the nursing capacity to help our island. And so, having said that, I didn't want to sign it at all because it didn't look the same as the first one. So I reverted back to the governor's legal counsel for review. So you have one. The first one was on March 17. That was the memo that was given to me for the first one, which the governor and I signed, but the other party didn't sign, which is HSP. And the second one was given to me on the 24th. And that one was still not negotiated, or there was no agreement because that was given to the governor's legal counsel. And then later on, as this thing was happening, they provided services, and they rendered it. And as they rendered the service, I, in particular, um, got the April 24th, and the governor had indicated to me that she'll proceed with signing it because we still need the nursing. We're having such a shortage, as you know, because a lot of our Guam nurses are not going to continue. Uh, these are nurses at the Guam Department of Education that are going to go back. They only have a contract up until the 29th with the department. And so what happens is after next week, I won't have these nurses at all. And so that's going to have a big impact. And we are moving forward, and we're still in this situation. We're not yet out of the woods. And the governor then revisited the April 24th MOA, and she signed it. I have it right here. What date was that? She signed it on the just a couple days ago. What is that? Yeah, so she signed it on the 19th of May. However, I didn't sign this one because I wanted to ensure that because she's acting on her powers to do so, I didn't want to proceed in signing it because, again, this one kind of like oversaw the first one. And I also wanted to ensure that there's going to be either a contract or a purchase order, and I indicate that, and I just said that that would have been the next step, but I didn't get anything back on my end, so I couldn't pursue with the second step like I did with DLS to get a purchase order. And so I refused to sign it to this day. And I indicated that to the legal counsel. And the reason why I refused to sign it is because I didn't have any monies to certify that those funds are available for that particular service, number one. And number two, that I'm not being able to bind the government with this because I don't have an identified funding source for it. And having said that, the governor utilized her purchase, emergency purchase, to do that, and so I still didn't sign it up to this day. So that's where we stand.
So what went wrong with that process? I mean, what should have been done to rectify it?
What should have been done was I should have gotten it back from HSP. So had I gotten it back from HSP on the date, the first one, which was March, the one I signed was March 19. If I had gotten it back from the first one was signed by the governor on the 19th, I did on the 20th, and then HSP didn't sign it. If I had gotten it back, then I would have, I would have executed the next step, which would have been a purchase order. So, having not gotten it back, I was just in the situation where I'm not going to be able to do anything if I don't have any means of getting any additional funding for this either. So we acted on an emergency because we needed to get the whole services done right away, because we had all these ports of entry and all these people coming in from all over the place, from Philippines, and we were already having 3 cases already in the beginning, and then another 2 cases a couple days later, and then by the time the Philippine flight came, we knew that all the whole people were getting infected were from the Philippines, and it was very, very, very serious to that point where we didn't want any other outbreaks. And it happened that having the quarantine facility in place with the nurses there to monitor and a doctor to monitor through HSP, we were able to contain several positive cases that resulted from the quarantine sites. And so that's what I did, and I seek advice from legal counsel, and that was with Shannon Titano to guide me through, and I continue on. Just like the overtime too, I didn't have any funding for the overtime, and the executive order was very specific that I cannot allow overtime for exempted employees, only non-exempt. That was clear in the executive order. And when I submitted, the request because of the nurses going and protesting and joining GFT, it is a liability because they did work. So I took it upon myself to follow the rule. And so because they're exempted employees, all nurses are exempted. The executive order doesn't say that they will be covered. So having said that, and having them protest and going out there and saying they're not paid and all this, I then prepared a memo. As the executive order says, you can request, for that to be done. So I requested that memo, but I did indicate in a paragraph that the department has no funds that is budgeted, nor does the department have any CARES Act for this type of funding. We only received 300,000, a little bit over 300 plus thousand, and that was not committed for overtime pay. So I indicated that, and I refused, and so did my ASO, refused to sign any form that is in the care plan to certify funding, because there is no funding. And that's the whole point that I was trying to make, that I was trying to follow everything to the T. And so we didn't sign the plan that has certified that funds are available, and we just turned it in, and then BBMR rejected it, and then later on the governor intervened and said we're going to find a way to pay this through perhaps the CARES Act. So We haven't paid anybody except those non-exempt employees, like the nurses and those that are pay grade K and below. And up to this day, we still haven't yet paid those nurses and other staff that are pay grade K and above. And that's what it is. It is what it is.
Thank you. I think this has been very informative. Obviously, I feel like we need to, I'm sorry, Senator Chalai, would you like to?
Yeah, can I just confirm a couple things that I heard earlier? Mr. Byrne is still there? Is Mr. Byrne here? Mr. Byrne? Yeah. Yes?
Yes, I'm still here.
Okay, thank you. Could you just confirm, did I hear correctly, when you said that payment was made on April 3rd for these hotel quarantine facilities, and did you say that you had CARES funds at that time and that's what you paid it out of, or that you will pay it out of CARES Act funds? What was used on April 3rd?
Yes, we will be using CARES Act funds, and yes, we did have the funds. We had all the funds by April 16th.
April 16?
Yes.
But the payment was made on April 3rd, that's correct?
Yes, but yes, it was.
Right. So you will use CARES Act funds, but at the time that obviously that the whatever certification, who certified these, Mr. Byrne? Who certified the payment? Was that you or someone else?
I do not know. Not without looking.
Oh, okay. And when I've seen some letters where the governor, directs payment compensation contemplated, and directs to Lester Carlson and Mr. Edward Byrne to make payments and pay invoices, and then it says so ordered. And so, Mr. Hoon, I guess I wanted to ask you, do you equate these letters with the so ordered to be an executive order pursuant to 10 GCA Chapter 19?
I equate them to the governor's order.
Executive orders?
No, ma'am. Executive orders are defined in the law that have various requirements.
All right.
It is an order by the
Yeah. All right. And then are you familiar with a federal law that allows payment without a contract, Mr. Hoon?
I believe that other more educated people in that area have answered that question today.
All right. Okay. All right. Okay. And then, so Madam Chair, I want to thank all of those who provided testimony. One more, just one more. Claudia, the federal grants, do you handle procurement for federal grants? Procurement of supplies, for example.
Yes, I do. Yes, I do.
All right. So those federal grants, they go through our regular procurement. They abide by our procurement laws?
Correct, our local laws.
All right. Well, Madam Chair, again, I want to thank all of them, everyone who's been here today. I'm sure we still have questions, but I want to thank you for those who have cooperated. I still find that, we have attorneys that are playing, in a role that have like giving advice, but we need also, if the procurement had gone through GSA, for example, Claudia has to answer any questions regarding that procurement. She could not claim, attorney-client privilege and then hide any part of that procurement. Same thing, if it had been procured, for example, by Linda DeNorsi. And I know that, public health deals with these federal funds a lot, and so they don't do it without contracts, and they don't, they follow the law to a T. And so, and they would never, I think, say they could not answer a question. And that's probably why our Guam law really puts this type of authority, with these government employees. And if we had asked the AG, who's not here tonight, was the procurement illegal? Probably we're going to get the analysis that there's some, I don't know, from what I've heard tonight, there's some, federal law that says we don't need contracts when we're using federal funds, and that we don't need to follow local procurement statutes when we're using federal funds. But the sad part about it is, if they are correct and we are going to spend these CARES Act funds without using any local procurement laws or abiding by any of them, we forgo reimbursement by FEMA, at least according to how it's been done in the past, unless they create new rules. And forgoing this reimbursement by FEMA really leaves us, very limited choices when we're using CARES money that we could be using on other things. For example, aid to over 16,000 employees that are on the record today without jobs. The estimates go up to 30,000. And that's really the downside of this. It's like by limiting our procurement ability, or by not following certain procedures, we limit our choices, and we're limited now to using CARES Act so that we can argue that we didn't need to follow any of the other laws. And unfortunately, because I think we could have got FEMA reimbursement for quarantine facilities, it seems like a very consistent use of FEMA reimbursement funds if we had followed our regular law. So I want to thank you, Madam Chair, for this hearing. I find it very
Thank you, Senator Terlahi. Yes, Senator Moylan.
Mr. Byrne, to find out who certified the payment.
No, Senator, I would have to go back into the record.
Thank you, Senator Terlahi. Senator Moylan, you have the floor.
Thank you, Madam Chair. And I would like to just continue with your questioning, very thorough questioning about procurement. And going into this, hopefully I can get a direct response. But media stories, we all read the paper, right? Reported about hotel suites, and including a presidential suite, which included, which probably part of this procurement process. So these comments are on the record, of course, and I just want to know, is this true? Did we procure a presidential suite? And if so, who resided in these suites, and how much did it cost, and who authorized these things as well? And final question on that as well, to that hotel. The media reports, and we're on record here, and we want to confirm this, was the former chief of staff, Tony Babalta, in one of those hotel rooms, along with other employees of the government. And these individuals were not under quarantine. Who's paying for these hotel rooms? I hope a response from any of the panels that's there. And I do thank the panel for staying up late with us, and I appreciate their time and their responses. Thank you, Madam Chair. If I can get a response from anybody, please. If you'd like me to repeat the question, I'll be happy to.
Sir, if I could just, I don't know how to answer your question specifically because they sound like just comments. But if you're asking if rooms were specifically paid for, the whole facility was paid for based on a formula. And again, I'll refer you back to that what do you call it? The documents that have been disclosed in numerous ways. They're also on our website for the executive order. So I think that answers the bulk of your questions. On the other stuff, we don't have that information, sir. You'll have to ask the person involved, not anybody else that is not.
Okay. Mr. Attorney High, thank you. So what we're saying is we purchased these rooms from from that hotel, and we don't know if we purchased the suite, the infamous 19th floor. Nor can we confirm that if there was ever the chief of staff of the governor's office was in one of these rooms, and nor do we know well, I understand we're paying for it, but did we actually purchase the suite? And was there, why did we purchase the suite? What was the purpose of the suite?
Senator, we are trying to answer your question as best as we can. So if it is a question rather than an accusation, we can say that all of the rooms in the hotel were purchased for the quarantine facility under the formula already disclosed in documents which have been made public. That is a direct answer to your question. As to your insinuations or accusations, we have no comment on that.
Okay, I'm not accusing. I'm just reiterating what is published. So I would like to ask the question, but I understand it. Please note it's not an accusation. I just want a confirmation, yay or nay. But if you want me to refer back to your documents, okay, I understand. If it's from the lobby into the garage and to the 19th floor, if that's what we purchased, and we don't understand why we purchased the 19th floor and the suites and what's the purpose is for, and you want me to refer your documents, all right, then I understand.
If you're obsessed with the 19th floor of the Pacific Star, I advise that you visit it. Otherwise, none of us have been there.
Thank you to the response, and thank you, Madam Chair.
Thank you, Senator Moylan. So I think, before we close, I just would like to perhaps, is there a way that we can coordinate the procurement? What is the plan moving forward? I mean, considering there were issues with unpaid vendors, and there was some connection to the lack of contracts, which to me has not materialized. I haven't seen a signed contract regarding the quarantine facilities on the dates when they were first procured. And it seems as if nobody seems to want to take responsibility for that at this point. But I think moving forward, the Public Health Authority, Director Linda DeNorsi, is the one that is basically directing the need. She's determining the needs of the island to respond to this pandemic, and it's concerning to me that she cannot get funds certified for helping increasing the medical capacity. I think really this oversight kind of shows the breakdown of the procurement system as a whole in regards to this pandemic, and also perhaps when we evoke the Emergency Powers Act together with Executive Order 2020-03, it even creates more of a confusion as how procurement, or perhaps it creates another avenue, which I'm questioning its authorization. But I think that we really need to come at a united front to figure out how we're going to address the pandemic with a united front as a procurement system. So I think moving forward, is it fair to say that the procurements are going to be led by the public authority and then go through GSA, because GSA oversees the procurement of the Department of Public Health and Services? Is that what we're going to, how we're going to move forward at this point?
Ma'am, I think, are you directing it towards anyone to answer?
Yes. So if you would like to respond. How are we going to procure as a united sort of way?
Sure. I think the governor did write you a letter asking you to consider changing some of the laws to help expedite things even on a normal basis. We do have some people that we think that could help explain the federal GSA part of things that might help the government of Guam procure more quickly on a traditional sense and even in an emergency sense. In terms of, you keep on, I think I do need to clear up. I don't think that the director, as the public Health Authority has said anything except for we needed quarantine sites. We needed all of these various things that we ended up getting. And how you want to decide whether or not that was allowed or not is a different question. But I do think that it's important to know that there are agreements in place and documented. They have been sent to you. They have been posted on our website. They do fully articulate every intent and how funds are spent. And I don't think it's a fair assessment to keep on saying that the public health authority didn't know what was didn't allow this. That there was no sense in taking care of government funds, and that there was no documents in place. You have all those items, ma'am.
If
And
I
then
can
finally, in terms
make
of
a
the
correction, I do not have all the documents. I was only sent the unsigned contract, so I don't have the complete so-called procurement purchase record, which is a new term for me. To me, there's no definition in procurement law, and I do not have a complete purchase record. And so that's what, with the invoking of the Emergency Powers Act, that's what I'm saying. There is a gap between procurement law and Emergency Powers Act. And
and oh, I'm sorry.
And I just want to clarify that I did not receive the full procurement file, or in your case, purchasing file, which still needs to be defined. And I was not saying there was improper. I was just saying that we need to work on, as a united front so that we address the pandemic. That is the priority with the direction of the Public Health Authority under Linda DeNorsi, and that there is a prescribed procedure of procurement that GovGuam is going to follow through GSA, because GSA oversees line agencies, including Department of Public Health Services, including the Office of the Governor, including Civil Defense, Office of Homeland Security. This is something that we need to work and hammer down. And in regards to federal law, I did not get the impression that there was a clear guidance by our government of what that is. And that needs to be clarified. To me, that has not been clarified in this oversight hearing. And I would like to work towards where we know what the procedures are, so we do not fall into potential or jeopardizing federal funds. I think that's ultimately the goal of this, is to learn what happened, what were some of the mishaps along the way, what is our concerted effort going to be? And so we don't fall into the situation where invoices are not paid, contracts. I have not seen a contract yet of those of the leasing of the facilities. And the mere fact that people were in the know and flags were not raised at the time. So there has to be somebody who stands up the procurement process in this whole affair. But I think what would help is that we have a framework we all agreed to. And I think it's fair to follow local law. That's what we have at this point, until we come up with something better that we all agree on. Because right now there wasn't to me, in my understanding, people didn't have an understanding of what was going on in a coordinated fashion. So that's
Madam Chair, if I can ask a couple questions. I agree with you, finding a way forward. I believe that just not this per se, this public hearing, oversight hearing, but really more so the public inquisition, right? From the media inquiries to the public, to the community, to the government, to the senators, all of that. I think that it has gone a long time already. It's been going on for several weeks. And I agree with you that we do need to find a way forward, because on behalf of GTRA and the hoteliers who have been put into some negative lights because of this, when they entered in good faith understanding that they were helping and the community and also working together with public-private partnership to provide these services during a very critical time. It is the responsibility for government to follow those procurement rules and to go through that, whether it's a purchase or procurement. I understand everybody's concerned with that and with the timeline, but I do know that there are laws also in place that before you enter a contract, you do have to secure the funding before you sign a contract, but also that there have been different iterations of this contract. One of the reporters wrote to me and said that the contracts are on the governor's website. And so I'm going to be looking at that. You know, I never received a contract, but I know that there have been different iterations because they have changed from only quarantine facilities, which all of our contracts, whether it was GovGuam or USS Roosevelt, those all started out with just quarantine facilities for asymptomatic travelers. And so those have all changed to include isolation. So I know that there have been several iterations. And it is concerning that if we don't have copies of those, then these hotels, unfortunately, are in a precarious position because, again, to have a contract placed without the funding secured before even CARES Act is a concern because they want to get paid. They actually lowered their price initially from federal rates, which would have qualified under even FEMA. And so I'm very concerned as far as the industry is concerned that, you know, everybody stepped up to participate in good faith, provided these services. Unfortunately, you know, 2 of those hotels are not participating today, even with the GSA's new procurement for the additional hotels. But we have to find solutions on a way forward because there is another Guam law that in lieu of a contract, you have to go with published rates of the hotel. And those published rates are generally higher. And those rates are published in the lobby areas, it's in all of the rooms, and you have to look at what the published rate is online. And so in lieu of a contract, you may end up, the government of Guam may end up paying higher rates because these hotels, and you have to look at every room and every service rendered during that stay. And so I think it's very important that we move towards completion of this discussion and find ways to really solve this problem and to close out the contract terms on these hotels. And like I stated earlier, it can't be just the hotels. There were other services that were provided outside of the scope of work to provide quarantine services. So if all the other services are approved, like additional meals, laundry services, all of the detail from public health, GPD, Guam Army National Guard, all of the support staff that provided services, how did those get approval, but not the hotel contracts? I think it's very important that if you've already authorized funds for all of those, that the hotels should be included in that authorization. Because they have already rendered the service and they have been acting in good faith. And it's been already a long period, and it's already hard enough for businesses to be closed down and losing money, where these businesses have been providing a huge community service in providing shelter in place during a very critical time. And it was where they had to give up the entire building. And so where they couldn't participate in other lodging services, like with the military, with the USS Roosevelt. So I think that we have to come up with the solutions, are correct, but in how we get there, I think is more important at this point, knowing that these were purchased under that emergency order, and then how do the other services, the ancillary services, how did those get authorized or paid out? But from what I thought I heard in a press conference a couple days ago, I thought all the payments were rendered to the hotels because the hotels were expecting to get paid before the new contracts went into place for Days Inn and Santa Fe. So can somebody answer that question, if the hotels finally received a signed contract, as well as if they received payment before the new contracts went into effect?
So that would be a question for perhaps either Claudia or Edward Byrne, can you answer that question?
My answer insofar as payment is that all the hotels' payments was released. I believe one of them was on the 20th, the remainder are on the 19th, and the EFTs are, the electronic funds transfers, could either arrive today or tomorrow morning.
But that's the complete payment. There are no outstanding invoices.
I'll tell you that. I can only tell you what I paid the invoices that I have.
Are there any outstanding invoices for the ancillary services?
Mr. Rhodes, I don't believe I have to answer your questions. Maybe you address your question through the senator.
Sure. I mean, we're all
yeah.
taxpayers, so.
Yeah, so you want me to ask the question on behalf of Mary, the question you just heard. Are there any outstanding payments to ancillary services, Director Byrne?
Not for the invoices I have.
Are there contracts associated with those invoices?
That's not something I have knowledge of. I told you before, Senator, that I had an instruction from Governor. You asked you asked the Governor's Council about that instruction, and I followed that instruction.
Regarding emergency purchases, is that correct?
Regarding payment.
Right. So are there any further questions? Okay, so we'll probably have another follow-up to see, and I definitely would like to follow up with the procurement record on all of these types of emergency related purchases. So I just want to thank everybody who stayed on, and I appreciate everybody's contribution and questions, and I'll be looking forward to seeing more of a collaborative, coordinated effort that is aligned with local laws and also as well as federal laws. So I do appreciate everybody's attendance today. Suduas Masi.